I'm Patty Collins. I'm the Senior Services Coordinator at the Independence Township Senior Center here in Clarkston, Michigan. Today I'm going to be talking about Medicare, and I represent the State Health Insurance Assistance Program. I'm a counselor through that program called SHIP, and we're going to again be talking about Medicare and the very basics and what you might need to know if you're turning 65 or just enrolling in Medicare for the first time. My training is through SHIP. It's through Ageways, which is the Area Agency on Aging. Again, Ageways provides information to seniors and information about all kinds of supports and services. Counseling about Medicare is one of those services that they offer, and they provide my training to provide unbiased Medicare information. So to begin, what is Medicare? Medicare is health insurance for three groups of people: those who are 65 and older, those who are under 65 with certain disabilities, and at any age with end-stage renal disease. The administration of the Medicare program occurs through the Centers for Medicare and Medicaid Services, otherwise known as CMS. The enrollment is through Social Security Administration, SSA, for most people. Enrolling in Medicare, it is automatic for those receiving Social Security benefits. You would receive an initial enrollment period package, which would be mailed about 3 months before, or your 25th month of disability benefits if you were receiving Social Security because of disability. And again, if you're turning age 65, if you're receiving Social Security benefits, you will automatically be enrolled in Medicare. How to enroll in Medicare? Again, if you do not get Social Security benefits, for instance, if you're still working when you're turning 65, or if you're on your spouse's insurance, and the enrollment, again, would not be automatic. So you would need to enroll with the Social Security Administration. You can do that by visiting the local office, by calling the Social Security phone number on the slide, or you can enroll online at ssa.gov. I do recommend that you consider enrolling online for the ease of the website and for making that happen the most quickly and efficiently for you. When you're enrolled in Medicare, either having done it yourself or having it automatically being enrolled, you will receive this Medicare card, this red, white, and blue card. So look for that in the mail with your packet. Again, you can keep it and accept Medicare Parts A and B, and you'll see on that card your name, the Medicare number, and then hospital Part A and that effective date, when it would be effective for you, as well as the Part B and the effective date. You do have the option, if for some reason you are choosing not to get Part B, but keep Part A, and I'll go into that more in a moment, to return it and to refuse Part B and follow these instructions that are listed on the back of the card. Because in certain instances, you may decide to keep Part A because there's no additional premium for Part A. Your contributions into the system as you've been working would cover that Part A premium. So there's no additional premium. Part B, there is an additional premium. So there are instances if you're continuing to work or be on a spouse's employee insurance that you may want to defer that until later. Just to begin, a few definitions. Premium is the amount you pay for an insurance policy, generally monthly. Deductible is the amount you pay for out-of-pocket costs for health care before your plan begins to pay. So you'd pay the deductible amount first, and then your plan amounts would kick in. The copay is the rate, the dollar amount you would pay for prescriptions, for doctor visits, etc. The coinsurance, that word is different than copay. That is the percentage you may pay after you meet your deductible. And cost share is the amount you pay out of pocket, including the deductibles, copays, and coinsurance, but not the premiums. That is defined as cost share. So 4 parts of Medicare. I've mentioned Part A and B, so we're going to go into a little bit more about what that includes. In general, we're looking at Part A, the hospital insurance coverage, Part B, the medical insurance, and then I'm going to skip to Part D, which is the prescription drug coverage. There's also, you'll have heard about, you see more about what's also called Part C, which is called the Medicare Advantage plans. Those are also, you'll see listed as usually HMOs or PPOs format. And we'll go into more detail with that in a moment. So again, your Medicare coverage choices. If you're, you can stay with the original Medicare. This is option 1. So that has the Part A, hospital insurance, the Part B, the medical insurance. Then you can add that Part D, the Part D drug plan, the prescription drug coverage, and you can also add Medigap. That's also known as a Medicare supplement insurance plan. So Medicare, Medigap plans and Medicare supplement plans, those mean the same thing. So again, these policies are private insurance, and they're policies to help cover them what Medicare does not cover. Medicare was never designed to cover everything. And so Medigap fills some of the gap between what you would pay and what Medicare would pay. So the Medicare Advantage plans, again, that's option 2. It's also known as Part C. And these plans are, again, the HMOs or PPOs, and they typically include Part A, hospital, Part B, medical, and Part D, prescription drug coverage. Kind of all combined together to make a Part C Medicare Advantage plan. It is still Medicare, it's just a different way of getting your Medicare benefits. Again, Part A, the hospital insurance, it also includes the inpatient care, skilled nursing facility, home health care, hospice care. There is a $1,736 deductible for those services. If you have a Medigap policy, that would cover that deductible amount for most Medigap plans. Part B is the medical insurance, includes the doctor's visits, outpatient services, lab tests, preventative services. There is an annual deductible of $283 for 2026. And there is a monthly premium for having Part B, which is the base premium for 2026 is $202.90 per month. Again, understanding Part A and Part B benefits. Again, the original Medicare, again, has well-defined benefits and exclusions, does not cover dental, vision, or hearing care except under special circumstances. Circumstances such as things like glaucoma, cataracts, some kind of eye or dental medical injury that would then fall under the medical Part B. But just routine dental, vision, and hearing care is not covered under that. It does not cover long-term custodial care. It does not cover assisted living, memory care units at facilities. May place limits on certain care items such as physical therapy, durable medical equipment, etc. And it does not cover the over-the-counter medications, which is why a separate Part D Medicare drug plan can be an option to purchase. So leading into that is, what is Part D? Again, that's the optional Medicare prescription drug coverage. It is optional. You do not have to have a drug plan through Medicare, but there are a couple plans even now that have a $0 premium. So I really encourage people to think about it, even if you're not on medications or on very low-cost generic medications, to consider enrolling in a Medicare prescription drug plan with original Medicare. Life, as we all know, can change. And if you choose to not enroll in one and want it later, you will pay a penalty ongoing from the time you are eligible until then the time you do choose to enroll, and that amount of that penalty does increase over time. For the longer you go without one and then decide you want it, the higher the penalty amount is. It is through private insurance companies, but it again is they have to follow the Medicare guidelines and rules to be a Medicare drug plan. You must choose and join a plan. It doesn't happen automatically that you are enrolled in a Part D drug plan. These plans have formularies, the lists of the drugs that they cover. You pay the drug plan a monthly premium, though there are a couple of plans that do have a $0 premium at this time. You may have deductibles and co-pays. Again, a certain deductible that you would pay to the pharmacy and co-pays when you go to pick up your medications. Joining a Part D plan, when you're new to Medicare, again, you have the 7-month initial enrollment period, 3 months before the month of your birthday and 3 months after your birthday to enroll in a specific plan. You can also change plans. I encourage folks to always take a look at their drug plan annually during the annual fall open enrollment, which is October 15th through December 7th. When you do that, if you change plans during that time, the coverage then would start January 1st. If a person does not enroll in a drug plan and then decides they want one, you can do so, but you can't enroll until that time frame to that October 15th to December 7th, with coverage again starting January 1st. There are special enrollment periods though, for those that are lower income, that have lost creditable coverage, or that a person that has moved outside of their plan's service area. So there are some special times when certain people can change their plans or enroll in a different plan. Creditable coverage, that term means it's as good as Medicare. The benefits are equivalent to what Medicare provides. And how to join a plan. You can call the SHIP number, which is listed there. You can call me here at the Senior Center in Clarkston. You can call the plan directly if you know what plan you want. You can call 1-800-MEDICARE for assistance. You can visit Medicare.gov, and I encourage folks to do that. That is a website I frequently use when I'm doing Medicare counseling. You go into the website, you put in your username and a password you would get established, and that helps you access some of your Medicare information and to compare plans. It's a great tool to use. What is Medigap? We touched on that briefly. Again, it's a policy sold by private companies. I can provide a generalized quote about what those costs would be to have one of those Medigap plans, but I do not sell the policy, so you'd still need to go through to buy a company. I can provide company phone numbers and names of who do provide those policies. Again, it fills in those gaps of original Medicare, helping cover those deductibles, the co-insurance, and the co-payments. They're lettered plans, but all the same letter plans have the same coverage. In the next slide, we'll talk about that. But what that means is a Plan G is a Plan G is a Plan G. It has to have the same coverage to be a Plan G. What would be different is what different companies have decided to charge you to have a Plan G. And so we can look at some of those different costs. Not all plans are offered to people under 65 with a disability. So if you're getting Medicare when you're under 65, these plans will be more expensive and fewer companies will offer them. This is a chart that shows the different lettered plans that are with Medigap. Not all of these plans are currently sold anymore. Some people have been grandfathered in to keep these plans. The most common plans at this point are Plan G and Plan N. On the left, it shows what benefits those plans provide. As you look down the like Plan G column and the Plan N column, you will see that those are pretty comprehensive plans for the coverage. Again, helping cover costs that Medicare does not, those co-payments and co-insurance costs. The other option, instead of original Medicare, you can choose what they call a Medicare Advantage plan, otherwise known as Part C. These are plans approved by Medicare, again, just a different way of getting your Medicare, run by private insurance companies. They will be in the PPO or HMO kind of format, which means that it's important to know what providers you want to keep and to make sure you're choosing a plan that your providers you want to go see are in that network. So there's a little bit of homework there to do. There's a tool on Medicare.gov to help do that. But you want to make sure, again, that any providers, hospitals, doctors you want to keep for sure will accept the plan that you're choosing. It includes Part A and B and usually the Part D drug coverage. Medicare pays an amount for each member's care through the Advantage plan. Most plans do include some dental, vision, and hearing coverage. You can often with these plans sometimes buy additional coverage, an additional rider for even more dental, vision, and hearing coverage if you would choose. Again, often you need to make sure that you're going to one of those providers that will accept the plan that you are covered by. Again, nice to have those benefits, but again, a lot of the plans, the basic ones are, you're going to cover like dental cleanings, x-rays, not necessarily that root canal or other extensive dental work. So it's good to know what that covers so that you know ahead of time. And again, you may have to use network doctors or hospitals. Especially with HMOs, you may need more of a referral from your primary. With PPOs, you often have a little bit more flexibility. They may cover some if you are out of network, but you're always going to get the most cost-effective option will be to always stay in network, whether you have an HMO or a PPO. This was new in 2025, just to note again, some of the other benefits that some of these plans cover will be dental, vision, and hearing. Some may have fitness, gym membership benefits. Some have what they call OTC or over-the-counter purchasing cards that can be used at different locations. And now these plans have to send you a notice mid-year to let you know if you've benefits you haven't used yet, so that you're aware of that and what possibly you might want to do. Joining a Part C Medicare Advantage plan. Again, you do that during your 7-month initial enrollment period. You can join during that fall enrollment time during October 15th through December 7th, and coverage to begin January 1st. Again, that is also a time if you're already enrolled that you can change plans, to try a different Medicare Advantage plan if you choose. There's an additional period between January 1st and March 31st where you can also switch to a different Medicare Advantage plan, and the coverage would become active the following month after your enrollment. If you need some assistance with that, of course, you can call the number on your screen. You can call me here at the Senior Center. You can call the plan directly, or you can call Medicare. Just a note about some of those extra benefits. If you do choose to purchase an additional rider with that plan to get more dental, vision, or hearing coverage, and then you change that plan, you're going to need to cancel that rider separately. Changing the plan does not cancel the rider automatically. So just a quick note about that. Okay, a few things to consider if you work past age 65. Be sure you're aware of all the relevant dates and deadlines. There are sometimes lifelong penalties for enrolling late in both Part B and Part D. Do check with your human resources department. That's very important to do. Every company can be different as far as if you're required to enroll in Medicare or Part A, or do you need to enroll in Part A and B? Just make sure that you're working with the HR departments about their requirements as you're turning 65. Again, many people that are working with their company can enroll in Part A and may choose to defer the Part B benefits until later. When you do then choose to enroll in Medicare Part B, say you've decided to retire when you're 67, for example, the Social Security Administration, again, you'd go back to them to enroll in Part B. They will also, though, ask for proof that you have had insurance from the time you turn 65 to the present day. So you would need to work again with your HR department to show that proof that, yes, I have had insurance during that time. That proof shows that, again, you've been insured and that you will not be assessed a penalty for enrolling in Medicare later than turning 65. And that's, again, the proof of the creditable insurance, like it's mentioning on the slide, to avoid a penalty. And again, especially if you are getting your benefits through a spouse, you'll need to, again, check with the benefits coordinator for health insurance to make sure you have creditable coverage. Creditable coverage is the term that's used to mean as good as Medicare. There is some assistance, some help for folks with limited income and or resources as we look at some of these costs associated with having the Medicare insurance. Those are known as extra help, Medicaid, Medicare savings programs. And if you think you might qualify or you know someone that might need this help, do call. You can call me here at the center or to call the number that was on the screen to get more information. And I can certainly set up a private consultation appointment with you to further discuss details of these programs. Marketing guidelines. A lot of times there's lots of mail and phone calls as you're turning 65 about the options. And you get, sometimes people tell me their mailbox is just exploding with things in the mail about Medicare plans. There are some guidelines, and the plans cannot solicit door-to-door, cannot enroll people over the phone during a solicitation call. And so if you have any questions or you think, wow, this shouldn't have happened, you can certainly call me, call the number that was on the screen if you have concerns about some of the marketing issues. But there are guidelines and some limitations as far as what the Advantage and Part D plans can and cannot do. Just know that preventative services are covered by Medicare Part B, like screening exams, wellness visits, lab tests, and immunizations to help prevent, find, and manage medical problems. They may find problems early when treatment will tend to work best. Preventative services, original Medicare, you pay nothing for most preventative services from a provider who accepts assignment. Assignment means they accept the amount that Medicare will reimburse the provider for. May require just a co-payment for the office visit. Again, other Medicare coverage, there may be a co-pay for the office visit, but the preventative services, again, there's a lot of coverage for that through Medicare plans. There is a Welcome to Medicare visit, which is a one-time visit covered within the first 12 months of enrolling in Part B. There's also a yearly wellness visit, which is available every 12 months, and it includes a personalized prevention plan, health advice, review of medications, any referrals that you might need to, again, the focus being on wellness. Again, these are just briefly, I'm just going to kind of go through this briefly as far as, again, some of the immunizations you can see on the screen on this slide that covers the preventative services. A few words about frauds and scams. Medicare fraud is the most common scheme affecting seniors, and you just need to be aware of that. Medicare, Medicaid is billed for services you've never received, or equipment you never received or returned. That's an example of fraud. If someone uses your Medicare, Medicaid card, again, make sure you protect your card and the number that's on that card. Or if a company uses false information to mislead you into joining a Medicare plan, again, that's another example of a fraud or a scam. Again, just some of the scams that are out there that we come across sometimes. There are calls asking to verify your Medicare number so you can get a plastic card. That is a scam. Calls offering you rebates on certain services, calls indicating your Medicare plan is being terminated suddenly, calls offering you a wellness van exam and saying, oh, we'll just notify your doctor. Again, many times the caller will be insistent, wanting immediate action, and just know now that these are many of the scams that are out there regarding Medicare. There is an SMP hotline to report a fraud or a scam. Please do report it, because again, it's important for us to track that and to be aware of what's happening and the scams that are out there. Fraud, sometimes, again, people get the number, and again, you need to report that too, because then if you've been received that says you've received medical equipment, and then you do actually need it, you go and try and use your Medicare card, you could be denied. So if you notice anything on your Medicare summary notices, that's not a service or a device that you've received, you need to report that. Again, just a counselor like myself can help you provide this unbiased information. Just number one, to understand the Medicare health plans. The more specific plans, I've given you a general overview of the parts of Medicare and your general options. But then a counselor can also, like myself, can go through and work with you to help choose a specific plan that would meet your needs. And whether that be to compare and enroll in a Medicare Advantage plan, to compare or enroll in a Medicare prescription drug coverage. Again, assistance to help identify and report Medicare or Medicaid fraud and scams. And if you would need assistance with enrollment into some low-income programs to see if you're eligible and to help with that enrollment, there is a counselor, me or someone else that can help you to do that. That assistance is out there to help you meet your needs for Medicare. One thing I did want to add was that then people say, okay, well, if I've made my decision and gone with original Medicare, and now I want to switch to an Advantage plan, can I do that? Yes, you can during the open enrollment time, that October 15th through December 7th window. People then ask, well, what if I start with an Advantage plan and then I want to go back to original Medicare? Can I do that? The answer is yes, but then there is a caveat to that that's important to know. So yes, during the open enrollment time, you could go back in and go say, yep, I'm going to sign up for original Medicare. I'm going to have original Medicare Part A, original Medicare Part B, go ahead and get a separate Part D prescription drug plan. The caveat comes with those Medigap, those supplement plans that we talked about. With that, when you first enroll, when you first are in Medicare Part B, you'll have a 6-month window called a guaranteed issuance period, where no matter what your health status, any of the Medigap plans that are selling in this area would have to sell one to you. After that 6-month window, if later on you want a Medigap policy, you can certainly apply, but they have the right to medically underwrite you, which means take into account any pre-existing conditions when determining your rate of cost for the plan, or if they would even accept you. So you can change back to original Medicare, get a separate Part D drug plan, and you may be able to get a Medigap policy. But again, the private insurance, those Medigap and supplement plans would take into account pre-existing conditions if you chose to switch after 6 months and get a Medigap policy. Again, if you would like to talk about a specific situation, look at more detailed information. Again, I'm here, other counselors are available to be able to help with answer some questions that you would still have. You can get more information or ask those questions. You can go to Medicare.gov, a great resource for information as well as to compare plans, a tool that I often use. There is the Medicare and You handbook, which would be mailed to you. It's also available on the Medicare.gov website. It's not something you need to read cover to cover. It is truly something that you can go to the index and look up different topics and get some information to help answer any questions you might have. You can call 1-800-MEDICARE. You can call the main number for the My Options Medicare Counseling, or you can call me here at the Senior Center. My name's Patty Collins, and my phone number is 248-625-8231. Hopefully you found this presentation helpful to answer some of your questions about Medicare.